My name is Katie David, and I'm doing my persuasive speech. Okay, so when you are depressed, it can feel like you'll never get out from under a dark shadow, and that's a quote from helpguide.org. And then depression like all depressive disorders, is a mental disorder. And I chose this topic because a lot of people in my family have gone through it, and you can get it. It's hereditary too, so you can. I know I told you that last time with my migraine speech, but yeah, I actually suffered from this, and then I lost an uncle that I never got to know, and my grandpa because of it, because of suicide. So millions of people are held tightly underneath its dark shadow and are affected by its commonly known symptoms. So recognizing and treating depression is what is going to help prevent all the negative outcomes that come from it. And it can ultimately save the life of you or someone you know, if you know anybody that's suffering from it, or after you learn the symptoms, you can kind of pay attention to that. Okay, so recognizing the signs and symptoms and understanding the causes and treatments can help improve and save the lives of many. It affects just about every aspect of a person's life, so it can lead to, like I said, suicide or divorce, or it can lead to just about anything because it affects you getting up and going to work because you don't want to. It affects you getting up and going to school because you don't want to. It affects just who you are as a person and like how you feel about life in general. It also affects the people around you. Like I said, it can even lead to divorce or something. So it can affect your family or your boyfriend or girlfriend or your friends or anything, just because they don't really understand if they're not going through it. They have to try to understand. It hinders them from being who they are and performing as they did, like I said. And then it can leave you with like a sense of worthlessness, hopelessness, shame, guilt, a lack of energy because you really just are tired and don't want to do anything, an inability to feel satisfied with the things that are going on in your life, or things that you were satisfied with your life and everything, and then now you're not. Persistent sadness and crying, changes in thoughts as suicidal, or changes in your actions, your weight, your appetite, low moods, low self-esteem, a lack of interest, and in every case it's completely different. So depending on the individual is going to depend on, what the treatment is going to be for it, or what side effects you even experience from it, because you can experience everything that I said, or you can experience a couple things. It just depends on the person. Studies indicate that the best way to prevent suicide is through the early recognition and treatment of depression and other psychiatric illnesses, and that's from the National Center for Health Statistics. I can't say that word. The results of depression can be horrific, and if not treated, can lead to suicide. Over 90% of those who die due to suicide have a mental illness at the time of their death, and the number one cause, approximately 60%, is untreated depression, and that's by Kevin Caruso. That's kind of a lot. That's 90% of anyone that dies from suicide is from someone that either suffers from depression, that hasn't, 40% of that is depression that has been treated, or you've sought out some sort of help, and then the 60% is from someone that didn't ask for help or didn't know how to get help, or their family and friends didn't know enough about it to help them figure out that that's what it was. The numbers are outrageous. AFSP, which is the American Foundation for Suicide Prevention, states that about 15% of the population will suffer from clinical depression at some time during their lifetime. 30% of all clinically depressed patients attempt suicide. Half of them ultimately die by suicide. That's kind of what I'm saying, is like some families go through it and they never experience that, or like my older brother experienced it in high school, but he's my half brother, so none of his family ever experienced that before, so he got it. There's different causes for it, and he has never experienced someone committing suicide because of it, whereas on my mom's side of the family we have. So it really, like I said, every case is different, and it changes from person to person. According to the National Center for Health Statistics, AFSP, depression is among the most treatable of illnesses. Between 80 and 90% of people with depression respond positively to treatment, and almost all patients gain some relief from their symptoms. But first, the depression actually has to be recognized. If you can't recognize it and you don't know that you have it, how are you going to know that you need to get help and that you need to find some way to kind of treat that, I guess. So I'm going to go ahead and show you something. I can read it to you and then I'll kind of pass it around. But it's from someone who actually experienced depression, and they wrote this. Depression is a never-ending black hole. Often I feel like I'm on the edge trying to climb out, but the black hole is thick and it's weighing me down. I see reality and want to be in it, but the force of the black hole is increasing in strength. I know I need help, I know I have to be stronger and move fast before the black hole swallows me. Sometimes it's a fight for my life. Let's kind of look at that. And then depression is a mental disorder that affects just about every aspect of a person's life, including their friends and their family. There are numerous causes of and treatments for depression. However, if left untreated, it can spiral out of control, leaving families and friends in utter devastation. Like I said, treatments are determined based on the individual. It's completely an individual thing because it could be, like I said, you could experience just some of the symptoms and it can go away with medication, or you could use therapy and the symptoms will die down. Or then it could be something that you're constantly dealing with on a day-to-day basis. And so you can even do, some people, lifestyle changes work out, so you just kind of narrow down, pinpoint the cause of it, and it kind of helps to figure out what the best way to go about treating it would be. Stand with me and the millions of others who have seen or experienced depression firsthand and learn how to deal and cope with depression.